Welcome back to this week's Clinical Conversations video. In this video, we are discussing the number one topic that I believe is neglected in both the physical therapy and personal training world. To me, this topic is awareness. I think a lot of us miss the boat when it comes to teaching our patients how to increase their awareness. And to me, it's not just awareness. Awareness is the key to getting out of pain. Awareness is the key to learning new movement. Awareness is the key to staying pain-free long-term. For example, one of the conversations I had with a virtual client this week was about myself, and that was that the way that I train myself is more like a bodybuilder type training protocol. The thing is, bodybuilding type training and movement and maintaining longevity sometimes don't go hand in hand. Bodybuilding is going to add tons of compression everywhere, which is going to decrease overall movement variability. Now, luckily for me, I've been able to stay pain-free with no major injuries. And what really hit me this week is that I feel like the only way I've been able to do that is by having enough awareness. Enough awareness of knowing right versus wrong, but enough awareness of understanding how something should and shouldn't feel. And I think that's key to implement with our patients and clients. One easy drill that I've talked about before is I like to go through pronation and supination drills to help patients understand how to isolate the foot so that it eventually can sync up with the hip. Because if we never teach them, they only feel what is their norm. So that over-supinated patient that comes in only feels external rotation, crazy supination, doesn't understand what pronation even feels like, even though we're asking them to get into it. Conversely, that flat foot individual has no idea what external rotation or supination feels like. So it just takes those couple drills to increase awareness. Now, the other thing I like to do from an awareness perspective is get people to understand where their natural biases are. Where are they on their right foot? Where are they on their left foot? Where are they from forwards to backwards? Are they asymmetrical? Do they feel the asymmetries? Do their feet turn out on one side more than the other? These are the things that we need to do to disrupt the pattern. We can't change something if the patient is not first aware of it. And there's such simple drills, but I feel like it's always the simple things that we overlook because we feel that it's too simple. It can't be that easy, right? Sometimes it is. Sometimes we need to do the simple things, and we need to do the simple things better. So the point of this video, of this Clinical Conversations video, is to hopefully increase your awareness of patients and or clients. How can we start to increase their awareness so we can drive better outcomes? Again, sounds like a simple topic. It's actually really hard when you start to dive into it. Why? Because they're not aware of it. They don't know how to do these things. And so taking the time, going through it in the clinic, in the gym, will be well worth your time. I have found it to be super beneficial for not only patients to learn, but for patients to actually start to drive results. The last thing I'll say about results is that if you want to increase mobility, the only way we can do that is if someone's foot syncs up with their hip. Meaning you can do all the mobility drills in the world, but if you want to increase hip internal rotation, we need a foot that internally rotates or pronates as well. And so you can quickly get mobility increases just by getting the foot to pronate and then syncing it up with the hip. Again, I use that as a reference because that's the easiest reference that I do with patients that really is a bang for their buck. So with that said, use this video to increase awareness. If you have questions about awareness or awareness drills, feel free to leave them in the comments below. I'd be happy to answer them, and I will see you guys on the next Clinical Conversations video.